Hello, my name is Gail DeLyden and I am a registered nurse here in Georgetown. I want to thank you for inviting me to your club meeting to speak to you about two common issues faced by men over 50, prostate issues and erectile dysfunction. The prostate issues that we will cover today are benign prostatic hyperplasia, more commonly known as BPH, prostatitis, and prostate cancer. Then we will talk about a topic that is uncomfortable for many men, erectile dysfunction. First, we will take a look at the male anatomy and talk about where the prostate is, and what it does. The prostate is located at the base of the bladder. It is a muscular, walnut-sized gland that surrounds part of the tube that transports urine and sperm out of the body. The prostate secretes seminal fluid, which combined with sperm produced in the testicles forms semen. A small little gland that has a very important job and can cause all sorts of trouble. The first prostate condition we are going to talk about is benign prostatic hyperplasia, or BPH for short. BPH is the most common prostate problem for men over 50. By age 50, 60% of men will have BPH. By age 85, 90% of men will have BPH. Symptoms of BPH include having to strain and wait to start urinating, having a weak, slow stream, taking a long time to urinate, and dribbling at the end, not emptying the bladder completely, frequent trips to the bathroom at night, and an urgent, sometimes uncontrollable need to urinate, but then only passing a small amount of urine. If any of this sounds familiar, it is important to discuss this at your next doctor's visit. Your doctor will ask you a series of questions developed by the American Urological Association and most likely do a rectal exam to evaluate the size of your prostate. I know that these rectal exams are unpleasant, but early detection and treatment can improve quality of life significantly. The cause of BPH is not well understood, but two things factor in for sure: age and testosterone level changes. Other risk factors include fat around the midsection, smoking, not exercising, and excessive alcohol intake. What happens with BPH is that the cells in the prostate tissue reproduce more rapidly, most likely because of the hormonal changes associated with aging, which leads to the enlargement of the gland. There are several drugs used to treat BPH. Proscar is used to shrink the prostate. It works by decreasing the amount of a natural body hormone that causes growth of the prostate. Flomax treats the symptoms of an enlarged prostate. It does not shrink the prostate, but works by relaxing the muscles in the prostate and the bladder. Cialis also helps relieve the symptoms of BPH by relaxing the smooth muscle in the prostate and bladder. The patient and the doctor will decide on a treatment plan, and the doctor will monitor the effectiveness of the treatment by monitoring the size of the prostate, relief of symptoms, and by checking periodic lab work, specifically prostate-specific antigen, or PSA, and urine cultures. The next problem that we are going to talk about is prostatitis, or inflammation of the prostate. Prostatitis can be bacterial or non-bacterial, acute, meaning it just started, or chronic, meaning it has been going on for a while. Most cases of prostatitis are caused by the backing up of urine, which then enters the ducts of the prostate and causes irritation and inflammation. If the urine is infected with bacteria, you guessed it, bacterial prostatitis. Bacterial prostatitis may also be caused by sexually transmitted infections. Even when there is not bacteria in the urine, because of the acidity in the urine, it can cause irritation and inflammation of the prostate gland tissue. Non-bacterial prostatitis can also be caused by stress or unknown causes. Symptoms of prostatitis are frequent urination, fever and chills, difficulty urinating, pain in the lower abdomen or back, or pain with ejaculation. Prostatitis is diagnosed through urine tests and cultures and rectal exam. Chronic prostatitis is usually caused by repeated bacterial infections, stress, and unknown causes. Bacterial prostatitis will require antibiotics. Non-bacterial prostatitis treatments include hot baths, relaxing while urinating, anti-inflammatory medications such as ibuprofen and Advil, and drinking more fluids. The doctor will monitor how you are responding to your treatment by you reporting fewer symptoms and repeat urine cultures, complete blood counts, and monitoring the size of the prostate. The last prostate issue we are going to talk about is prostate cancer. Prostate cancer occurs when the cells in the prostate start to grow uncontrollably. Prostate cancer is caused by DNA mutation of the prostate gland cells. These cells reproduce rapidly, faster than cell death, which leads to uncontrolled tumor growth. Some cells grow more rapidly and are more aggressive. The treatment for prostate cancer varies depending on the stage it is at when it is discovered. Surgery or radiation are non-drug treatment plans. The doctor may prescribe hormone therapy to shrink the tumor, such as Zoladex or Ulexin, which lead to decreased production of testosterone, which decreases the spread of cancer of the prostate. If the cancer has spread outside the prostate, chemotherapy drugs such as doxyfreeze or cabazitaxel might be prescribed, which cause the death of rapidly replicating cells, particularly malignant ones. The patient and doctor will devise a treatment plan based on the stage of cancer. Monitoring may include active surveillance, which would be regular follow-up blood tests, rectal exams, and possibly biopsies performed to monitor progression of the cancer. If tests show the cancer is progressing, patients that had been using hormone therapy or chemotherapy may opt for surgery or radiation. I have a lot of good patient information brochures on the back table for you about BPH, prostatitis, and prostate cancer. The brochures contain information about symptoms of each of these prostate issues, what causes them, how they are diagnosed, how they are treated, and what to watch for. The most important education I can provide to you is to always talk to your doctor about any issues that you are having. Don't hesitate to ask questions, and if your doctor prescribes medication for you, take it consistently and as directed. Another area of concern for men of all ages, but particularly men over 50, is erectile dysfunction. Now, we have all laughed at the commercials on TV, and it is constant fodder for the late night talk show host jokes, but it isn't very funny for the men experiencing it. In order to understand erectile dysfunction, we first need to understand erection. Achieving an erection is really a very complex event involving the psychologic, neurologic, endocrine, vascular, and local anatomic systems. A man achieves an erect penis from stimulation, such as touching or rubbing the penis, or seeing or thinking about something sexually stimulating and exciting. When stimulation occurs, the brain takes over and works with the nerve endings in the penis. The brain and nerves send messages to the penis to relax, resulting in increased blood flow to the veins and arteries in the penis. The blood fills the penis, leading to pressure that is contained and supported by tissues and membranes in the penis. Blood entering the penis is essentially locked in those tissues and membranes, which allows the pressure to be maintained, creating and holding an erection. The testicles also release testosterone, which play a role in determining when an erection will happen and how firm it is. 52% of all men experience erectile dysfunction at some point in their life. In order to achieve an erection, the mind and the body have to work together, and a breakdown in communication among any of the integrated systems can cause erectile dysfunction. There are many causes of erectile dysfunction: high blood pressure, high cholesterol, obesity, diabetes, tobacco use, alcohol use, sleep disorders, stress, depression, anxiety, aging, renal failure, and medications, just to name a few. There are drugs that can treat erectile dysfunction, including Viagra, Cialis, and Levitra, which all increase or enhance the blood flow to the penis. The doctor will monitor the effectiveness of the treatment by patient reporting the ability to achieve and hold an erection. If not effective, the doctor may suggest alternatives, one of which may include counseling to determine a potential underlying psychological cause. I have a brochure in the back which lists the causes, diagnosis, and treatment options for erectile dysfunction. A couple of key education points that I would like to emphasize. If you use nitroglycerin for chest pain, you should not use medications such as Viagra, Cialis, or Levitra. All of these medications dilate your blood vessels. Taking them at the same time could cause your blood pressure to go very low, which isn't good. If you are taking a medication for erectile dysfunction and have an erection lasting more than 4 hours, please seek medical attention, as a prolonged erection can damage your penis. Lastly, if you are just starting to have trouble getting erections and you have just started on a beta blocker or diuretic to lower your blood pressure, talk to your doctor about these new symptoms. Your doctor may be able to prescribe a different type of blood pressure medication. It is important, however, that you do not stop taking your blood pressure medication just because you're having these new symptoms until you have spoken to your doctor. That was a lot of information. Please feel free to pick up brochures on any of the topics that we have covered, and I will be happy to answer any questions that you have. Thank you for your time and attention.